Thank you all for joining us today. I'm Jon Harol with Lighthouse Lab Services. We are going to be presenting today. Our webinar is on the wage and morale survey, and we appreciate you guys joining us. Jon Harol, President of Lighthouse Lab Services, and I'm joined by Tara Luellen, who's our VP of Lab Director Services, and we're going to be combining to cover the topics of both salary and wages throughout the industry, as well as morale, and hopefully a little bit of commentary that's helpful to you guys in terms of tips on what you can do with that information and how it can be applied in your laboratory to improve some of the current conditions. A little bit of housekeeping as we get started. Reduce your chances of buffering by closing any heavy bandwidth apps that you have running in the background. Yes, this webinar will be recorded, our most common question. You can also head over on the right side panel, you'll see a handouts area that you can click. And when you click there, there's 3 different handouts that you can download. And one of those is this slide deck with all this information. So if you're concerned about getting this, you want to use it, that's part of why we're creating it. It's free. Feel free to head over there and download any of those handouts so you have them. But you will receive a link to the recording following this. It's automated, so the email address you use to sign up will receive a link to the recording. So if you wanted to share it with anyone or rewatch it for any reason, you'll have access to that. Questions. No need to wait till the end. Ask us a question at any time, but we prefer you use the Q&A section to do that. So you can put your questions in there, and then we'll probably deal with them towards the end. It's possible we'll be able to see and address them in real time, but more likely we'll tackle those questions as we wrap up. There is a chat as well. If you're having technical difficulties, we'll do our best to help answer some of those as we go through. We will be running some polls during the webinar, so you may see those pop onto your screen. We encourage you to go ahead and participate in those polls. That helps us to get some feedback from you guys, the audience, on what you're experiencing, to make sure that it's in line with what we're seeing, and helps everybody on the call to get a little bit smarter. So we appreciate you joining us. Lighthouse, just a little bit about what we do so you understand our perspective and the context from which we view the industry and the lens we see everything through. We are the nation's leading recruiting and consulting firm that specializes in the medical lab industry, right? So we staff labs. We have over 1,000 CLIA lab customers that we're dealing with, and we're helping them to staff their laboratories mostly with permanent. We feel like that's the best solution. If you have a permanent need, we try to put in a permanent candidate in there. And so if that's something that we can help you with, let us know. We put these webinars on for free. The reason we're able to do that is we do provide services. So if you're in need of those services, please keep us in mind. One of the things we hope to accomplish with this survey, so we surveyed over 1,000 medical lab professionals throughout the country, is to really get you guys good data. So there is a ASCP survey of not morale, but of wages that happens every other year. But we saw there's a little bit of a gap with that information lagging, because it almost lags 2.5 to 3 years by the time the information gets to the street. That we felt getting that data more timely would be helpful as you guys advocate for yourselves in your laboratories, to your human resource departments, to the C-suite, as it may be, that you'll have some data that you can point to. So that's why we wanted to do it. I also noticed that the other wage surveys tended to only survey hospital and health systems. And it becomes a bit of an echo chamber where they were surveying their own staff, and they're getting, this is what the current salaries are. And then they're hearing that and they're saying our salaries are in line because they're what everybody else is paying. Those are less prone to market conditions. They're pretty locked, those salary scales. It's really hard to change them inside of a hospital environment. And lab managers often don't have discretion to just freely offer more in order to get talent. So what ends up happening is those positions go unfilled. People end up working overtime, and they're filled through other means. And it doesn't really show the real cost of labor, right? So if you just don't pay extra and you leave that role empty, and then you use current staff or temps or travelers, you're paying a much higher rate really for that labor per hour, but it's not caught in those surveys. So we tried to craft our survey in a way that would catch some of that, would catch more data from the independent market, which is a little bit more subject to market forces because the rigidity of those pay scales is less, and they're able to float up and down as demand increases and decreases. So we wanted to capture all that information and give it to you so that you guys could advocate, because we feel like that's part of the solution. People have been complaining for a long time that the salaries are not where they need to be. I agree. And complaining on its own that hasn't gotten us great results, right? So if we can come with data, we think that that's going to enable you guys to help affect change. So that's why we provide this. Like I said, under handouts, you can have access to this slide deck and you'll get this information. We have a full page report. Okay, so let me just go back real quick to go over some of the other key points of this. So there's over 1,000 medical lab scientists that responded. The results showed that there was a salary increase again in 2023, but it was modest, right? So between 1 and 5%. It's about what a lot of other industries saw as well. And that staffing levels and burnout continues to remain pretty high, and we'll get into that a little bit further. So the demographics of this survey, a majority of the people, plurality of the people, 40% had more than 21 years of experience. That's a really interesting breakdown. It's not surprising if you've been in the lab for a minute, but it is different from most other industries, right? So we do have a very heavily weighted senior workforce that have been in the industry for a while, but there's still 20% of the respondents. The next highest group are people with 0 to 5 years of experience. Of those people working in the laboratory, 72% are working in a high complexity laboratory, which is a small number of laboratories according to the CLIA statistics, right? If you look at the number of CLIA certificates out there, there are around 200,000, I believe, somewhere around that. And the number of high complexity is, less than half of that, maybe 30% of that. But a lot of those waived CLIA certificates make up the biggest group. A lot of physician offices, a lot of point of care, long-term care, and are being staffed not by specific medical lab professionals, not by individuals that were trained to work specifically in a medical lab, but are able to do some of the point of care testing. Okay, so the demographics and breakdowns, not surprising if you've been in the lab, but is very outside other industries is the gender breakdown, with 74% of the workforce being female, 24% being male, and 2% non-disclosing or non-binary. So that is something that is interesting, right? And I think people in the lab are aware of it. I don't have commentary on exactly why that is the way it is. You hear some anecdotal things about people going into this field in the 70s, 80s, 90s. It was really pushed towards as a female career path. So maybe that's it. A lot of times you have people that were thinking about going into nursing, which is also heavily female, that realize that they maybe don't want to have as much patient contact, and they may redirect into the laboratory. But a lot of different reasons that could factor into it, but it is a factor. It's something that we wanted to report. Also on the ethnicity, we track the national demographic breakdowns for ethnicities for the most part, but the white or Caucasian population is actually lower than the national average, which is closer to maybe 70-75%, depending on how it's calculated. So the lab is more diverse than the nation as a whole. So that's an interesting piece. The Hispanic Latino population is lower in the lab, so underrepresented compared to the national numbers, only at 5%, where we see it as high as like 19-20% in some surveys of national demographics. The Asian population inside the laboratory is much higher, where this is closer to 1 to 3% in most surveys, and we're seeing it up around 9%. And then we did have a decent number, 6% of non-disclosed, so it's hard to know where that breaks down as well. And then the breakdown by position is almost half of all respondents were bench level technologists, 20% being managers, 15% technicians. The lab directors made up 7%. Those are the administrative directors. And then the MD, PhD, CLIA lab directors making up about 3%, and 2% are administrative staff. Other key things that we saw or thought worth mentioning, 97% jump in job cuts in healthcare, right? So we saw the first 6 months of 2023 see a lot of layoffs and cuts. There was a lot of laboratories that have gone out of business. The number of CLIA labs that have closed is at like a 20-year high. That is a pandemic hangover, where we saw a lot of the number of CLIA labs that were opened over the course of the pandemic was at a high, right? So we saw a lot of new groups enter into the laboratory testing market and start their own laboratories for employment, for schools, just all kinds of COVID testing laboratories that filed for CLIAs, and a lot of them are closing up shop. And so we saw jobs related to that go down. So almost a 97% bump in job cuts. National unemployment's at 3.7%, up from a 5-decade low of 3.4, still pretty low historically, and I think in a range where far from a recession. Contract labor expense still really high. I mean, it really surged, 258% increase during the early stages of the pandemic by using contract labor, right? So travelers and temps were required in order to get the job done, and they really demanded wages at some point, probably fairly so, because the hours and conditions they're working in were very challenging. And so we saw that really spike. I think we'll start to see that normalize again. Healthcare sector overall has seen a 3.9% decrease in actual versus projected job growth. So we see a little bit of a slowdown there. And I think that's also related to like a pandemic correction. Morale. Staffing continues to impact morale, probably not surprisingly. Most individuals are saying that their lab is understaffed, 67% saying we've got staffing issues. We're either significantly or moderately understaffed at a minimum. Only a small percentage of labs saying that their lab is well staffed. So that's pretty in line. We also see the satisfaction track with that, right? So the number of people saying their laboratory is understaffed correlates pretty closely with those that are unsatisfied, probably not surprisingly, that when you are not adequately staffed, that it's going to affect morale. So I think we all know that, and it's just good to have some data to put behind it so that you can share that with your teams or C-suite if appropriate. This is interesting. This is a study or a graph showing how morale compares to years of experience. We found that individuals with 5 or fewer years of experience were reporting the highest levels of dissatisfaction. It came down a little bit this year. And previous year, it was as high as 41% were dissatisfied. It's down to 32% now. So we did see a drop in that, but it's still the group that sees the most dissatisfaction are those new techs in under 5 years. Honestly, when this surfaced in, I don't know if it was last year's or the year before's survey, I was surprised to find that. I think I had the perception that individuals that had worked in the laboratory for a long time, 20 plus years, maybe were starting to feel tired, worn out, jaded, burnout, but we didn't see that. Those are the individuals showing the highest level of satisfaction. But we have started to connect this with rise in complaints about bullying. So we wanted to report on that. I recently asked in a survey on LinkedIn, which I had about maybe 350, 400 people, lab professionals respond to, if they're experiencing or seeing bullying in their laboratory. And surprisingly, 75% are saying, yes, we see it, it's real, it's an issue. I was speaking with someone in the ASCP office, and they mentioned it as well. So I don't know how much this has been covered. We may try to dig into this a little bit further, but certainly would point to the reason that individuals with 0 to 5 years of experience may feel dissatisfied. And a lot of the anecdotal commentary that we received was that bullying happened by seasoned techs to individuals that were new to the laboratory. A little bit of territorialism. This is my department. This is my machine. This is, I'm the one that handles this. Don't touch my stuff. So I think the takeaway here, hopefully, is, bullying in general, I don't think should be acceptable. And hopefully that's the viewpoint of all of you, that maybe this is happening a little bit because people are overworked. You have a new person coming in and maybe you're being asked to train or mentor them, and you don't really have the bandwidth to do that because you're being asked to do a lot of other things. And so that comes out in some frustration potentially. But big picture wise, these new techs coming into the field are part of the solution, right? And keeping the techs that are graduating in the field is really important. And it is the answer to not working Christmas and double shifts and, being adequately staffed, is just making sure that we hold on to those techs that do enter and make them feel welcome. So if you're a laboratory manager and you're trying to figure out how can I compete for labor and talent in this market that's candidate short, I think this is a really actionable area of how do we make those new techs that are coming in, maybe they're coming through on a rotation, maybe they're just hired, to really go the extra mile, to roll out a red carpet, to make sure that they feel welcome. How do we connect them to the training that they need, a mentor in the lab, someone that they're going to feel like a connection to the team and not feel like an outsider. So I would say that would be a really key takeaway if you are seeking to improve the morale in your lab and improve the staffing levels inside of your lab. And I'm going to hand over the mic to Tara Luellen, who's going to give us a little bit more information on how the salaries break down by position.
Thank you, John. Good morning, everybody. This first slide, I'm going to dive into the different positions and what they self-reported as their salaries and compare that to the results of last year's survey. So the first thing I want to mention really quickly is the difference in the CLIA lab director salary here. I don't want you guys to think that CLIA lab directors enjoyed a significant bump in salary. That's actually not what is represented here. What happened last year on our survey is we realized that the way that we asked the question about are you a lab director was a little bit unclear. And we received some respondents' answers who we believe were administrative, technical, operations directors within that category. And so we tried to do a better job of clearly asking what type of lab director respondents were this year and breaking it down better between an actual CLIA lab director, which, given that most of our respondents were from high complexity labs, that is someone that has a board certification and a PhD, an MD, or a DO in most cases. And so what we have here is what I feel like, given my experience working with lab directors and pathologists, is a much better picture of what CLIA lab directors are currently paid at $213,000 on average for the 3% of our respondents that were CLIA medical directors. The other positions, we don't see obviously a huge change. We wouldn't expect to see a huge change. John mentioned earlier that 1 to 5%, I believe, salary bumps for most people, which was pretty in line with other industries, in the last year. So just a little bit of an increase over last year from reports of administrative or technical or operations lab directors, a little bit of a bump for support or other positions, basically the same for managers. And then what I thought was really interesting was our technologist, technician, and lab assistant or accessioner roles. 2023 is showing just a little bit less salary for those individuals. So we talked about that, to try to figure out why that might be. And what we believe is true is, during the pandemic, the need for testing was just greatly increased. And we saw many labs open to, address the need for COVID testing in particular. And a lot of those labs, unfortunately, are shuttering now that the need for that testing is no longer there. So what we're seeing is those positions which were in high demand during the pandemic, they were, a little bit higher salary because the demand was so high. And now that some of those businesses and labs are shuttering their doors, then we're seeing the wages for these individuals come down just a little bit. We don't unfortunately have data for pre-pandemic because we just started this survey last year. But in the future, we hope to have, gained a lot of extra data over the years, and that way we can compare and contrast a little bit better to give you better insight about the trends that are occurring. I wanted to talk a little bit about the gender wage gap. John mentioned that most of the respondents for our survey were women, and that is what we expected given that we know women dominate the field in terms of lab personnel. And what we saw from our respondents is a 19% pay disparity on average across all positions for females compared to men. And you can see there the average compensation of our respondents. What I wanted to highlight here is that, while that's an issue, I feel very strongly about this. I identify as female. I want to get that wage gap, zero. This is pretty common across all industries. We've got a reference there to Forbes, who earlier this year reported that, on average, a white or Caucasian woman in the US is going to make 82 cents for every dollar a white or Caucasian male makes. And so, 19% pay disparity from our respondents is really in line with that. Unfortunately, Forbes also reported that, women of color are actually paid like 55 to 60 cents on the dollar of a white male. So obviously a lot more disparity there. Obviously this is something we want to continue working on and continue advocating for, commensurate wages for everyone. But our reports, our respondents are reporting pretty, consistent to statistics as what we're seeing in the US in general. I thought that was interesting. One of our survey respondents, mentioned that, there's an underappreciated level of pay inequality between male and female directors. We really appreciate your anecdotal information that you guys provide to us, by the way. So anytime you're completing anything that we're asking of you, this kind of insight and detail is really helpful to help shed some light on some of the numbers for us. So thank you for that respondent. This is definitely something we need to keep working on and advocating for, like I mentioned. I talked a little bit about the CLIA lab director salary on the first slide I covered. I wanted to dive in a little bit further here. Lab directors, pathologists are my specialty, and that's what my team does specifically here at Lighthouse. So of our respondents, we had 34 PhD or MD DO lab directors, and 28 of those individuals told us about their compensation. That was not a required field. So we ended up with an average of $213,000 in salary per year. That's base salary. That's what we asked specifically. And I would agree that that's in line with what my team is doing in terms of recruiting and staffing labs with full-time lab directors and pathologists. Obviously, pathologists can command a little bit higher salary. PhD lab directors, depending on the situation, a little bit lower than that. So we get an average of 213. And I think that that's really a good picture of what's happening in the industry right now. And if you're looking to hire someone, that's kind of what you need to budget for in that range. Obviously, it's dependent on a number of factors. And we can dive into that if you have any specific needs for a lab director or pathologist, of course. These are just averages from our respondents. Of the respondents, 43%, so almost half of our CLIA lab directors were working at multiple labs. You guys probably know that a CLIA lab director can oversee up to 5 laboratories in most cases. Some states have more strict requirements and allow fewer than 5, but the national ability is 5, and CLIA allows 5 lab directorships per individual. And of our respondents, they earned about $49,000 in additional compensation from consulting work. A lot of times these CLIA lab directors they work full-time jobs. They may work as a full-time lab director in a hospital or a larger laboratory or pathology group. And then they kind of moonlight as a part-time CLIA lab director for up to 4 other labs. You guys may know about our part-time lab director program, and that's how we work with these individuals in a lot of cases and are able to supply small to moderately sized labs, sometimes hospital labs, depending on the size and what they're trying to do, with a very qualified CLIA lab director on a part-time basis, which is makes a lot of sense economically for a lab, particularly if you don't have a high sample volume or you're not doing a bunch of different specialties. 94% of our CLIA lab directors were currently actively fulfilling a CLIA designated role for their labs. So of the 34 respondents, almost all of them were currently either a lab director or technical supervisor, or clinical consultant, something like that for at least one laboratory. So these are currently active lab directors and supervisors. The demand for pathologists and lab directors remains really high. What we have here is a graph that we took from the Pathology Outlines jobs page. They do a great job of showing the number of open pathologist jobs since, you can see there, from January 2017 to present day. And you can see how drastically that increased, the number of open jobs increased during the pandemic, right? We have kind of like a low lull that was almost back to 2017 levels of open pathologist positions in the summer of 2020, and then it shoots up. And I think that, you know, coincides with the opening of additional laboratories to address the pandemic. Pathology groups and hospitals needing to expand or add personnel because of the need for additional testing. But I want to highlight here that what we don't see is a sharp decrease now that we're post-pandemic. Actually, we're kind of at pretty much the all-time high, just a little bit lower than the all-time high, which was the 1st of January 2022, it looks like. So there's over 700 current positions open for pathologists. And I think we're all aware that the pathologist market is only going to continue to have a high demand. Part of that is due to the fact that pathologists are retiring. We have a number of pathologists who have been in the field for a number of years, and they are looking to leave the field for retirement or part-time work. And we're just simply not graduating enough new pathologists to fill all of the pathologist roles that we expect to leave. So while hiring conditions that led to the Great Resignation, I did a talk at the Executive Board College last year about this. They're not the same for bench level roles, and we're not seeing that the same demand there necessarily, but the demand for pathologists and lab directors has remained high, and we expect it to continue to do so. So just wanted to report on that, especially because my team and I, that's our sole focus. If we can help you there, we are happy to do so. In terms of our respondents that do bench level work, 93% of the respondents are permanent employees that do some bench level activity. Majority of those were first shifters. You know, we've got almost 70% in the first shift, much, you know, lower on the second shift, obviously, and even lower in the third. We have some people that are variable at 11%, of course, they change shifts. And then we wanted to throw in the average shift differential there. So it's about $3.65 per hour difference. You get paid a little bit more if you're on the second or third shift because those shifts are harder, you know, in terms of the hours that you need to work and can weigh on you, I know. So they offer a little bit better compensation sometimes to sort of offset that. We didn't want to meet today and not talk about how we can keep good talent, right? Because especially as, like I mentioned, the pathology market, the pathologists, they're leaving due to retirement and things like that. We want to be able to retain our good workers as much as we can. And how can we do that? We wanted to empower you guys to make a path for keeping your top talent. And so we have a few bullet points here that I think are really important. One of the most obvious ways that you can, you know, keep good talent while also encouraging their growth alongside of your lab is to create a clear path of growth for them. So here's your goal. If you meet X goal, then you will be promoted to X role. And I think that with the CLIA designated roles, we have testing personnel, general supervisor, technical supervisor, clinical consultant, lab director. Those are the 5 roles required for high complexity labs. That kind of builds in a little bit of a path, but you can get really creative in terms of supervisor positions or manager positions that are not actually a CLIA designated role to help, hammer out a pathway for your current employees so that they know that they're going to progress alongside of their skills growing and alongside of the lab being successful. So creating these career ladders, especially for CLIA roles, is a great way to tackle that. Another thing that you can do to improve your current employees, it's one thing to recruit someone, and we're going to talk about that in a minute, but once you get them, you want to keep them, right? Because of all the cost of recruiting and training the individual. And one thing I think that a lot of our industry and well, just in general, actually, is that people don't take into consideration a lot of times the current job market or reanalyze their approach. Once you get somebody, once you secure them, you're kind of not worried about it. And I think we need to be a little bit worried about it. If we're taking a look at the current job market for these individuals, for your area, what are your competitors offering them in terms of salary, growth, the career trajectory, things like that? You have to stay competitive or you will see your top talent jump to your competitors. So being humble in terms of looking at your current package for your already employed employees is a great way to make sure that you're staying in line with what other offers they might be considering otherwise. And then additionally, investing in those employees to cultivate strong managers and elevate them. Obviously, they need to learn new skills to be promoted or to climb that career ladder that you're creating for them. And so you're going to need to invest in professional development for them and additional training and how do they get extra skills. Maybe it's creating a mentorship program inside of your laboratory where existing managers or supervisors could help train newer employees. Like John mentioned with the bullying, kind of rolling out the red carpet to some of these newer employees to make sure that they want to stay in the industry is so important. And so investing in them is just going to show that, you care about them and their growth and their career path. And they're going to return that to you in terms of staying in and valuing you as an employer. And we had one survey respondent that this told us that they were able to hire a new staff member because they got a retention bonus and wage increase. Otherwise, they weren't competitive. So he or she was just reiterating what we're encouraging you to do here is make sure that you are competitive with especially your competitors. Engaged employees stay. We know that. We also know that they have better performance, 28% better, right? If they're engaged, they outperform disengaged employees by 28%. That is huge. So how can you keep them engaged? Be present as a leader. Elevate folks to manager or supervisor level, or give them a mentorship ability to mentor these lower level employees so that it's not, your C-suite or your highest level people that are having to invest all of the time in them. But whenever a leader is in front of their direct reports or other employees, being present is important. Attend to them, listen to what they are having to say, listen to their input and feedback, and then they will feel heard and they will come to you with positive or negative things in the future. And just having that conversation back and forth makes people feel a lot more valued and important and like you care as an employer and a manager. And that's what's going to make them feel engaged and want to stay. Meeting regularly with your employees is also very important. We recommend weekly or at least monthly meetings with every direct individual. This is a one-on-one meeting kind of thing usually. There's no replacement for that, especially as, some roles are virtual or work from home now, not necessarily always in the lab, but, we have part-time CLIA lab directors, for example. when they come on site, they need to make an effort to meet with those employees and hear their feedback and talk to them, and not only just do the competency evaluation and things like that. They've got to be present and also give the employees a chance to be heard. And then keeping your employees informed on how the company is doing, the goals for the future, things like that. Just make them feel as though you're leading transparently and that they have, they're invested in what the company is doing and trying to do, and they feel more engaged by you doing so. Now, we talked about retention. I want to talk a little bit about your hiring approach. Now, this is for open positions, obviously. So once we get those filled, we want to work really hard to retain those individuals like we just discussed. But, a lot of people are having trouble hiring folks in general right now. Unemployment is low, like John mentioned. So how can you make sure that, for your open positions, you don't spend any more time, effort, and money on recruiting for those positions than you have to? Because every day that you don't have a position filled, it's lost revenue for your lab, for sure. So looking at how you currently recruit is really important. What is your strategy? What do your job descriptions look like? What face are you presenting to the public about your laboratory? And that's going to say a lot to the people that either apply or don't apply. And so it's interesting to look at that and make sure that you are currently recruiting and offering something that is in line with your competitors, like I mentioned before. One thing that a lot of people gloss over or don't put a lot of stock in is their company's reputation within the industry. And I can't stress enough how much how important that is to a candidate, especially top talent. You need to have a good reputation and maintain that reputation. And you're going to have a hard time filling positions, especially high-level positions, if you do not have a good reputation in the industry. So keeping an eye on that and making sure you're doing all the right things to maintain a good reputation is of the utmost importance. And then what are your current retention levels, right? Like I mentioned, if you have secured great talent, let's work hard to keep them. And what does your retention level look like currently? If you have high turnover, before you start looking at your hiring approach, obviously you kind of have to do that concurrently, because if you have open positions, you need to fill those. But what could you be doing differently in terms of retaining top talent so that you don't have to recruit so much for open positions? So really analyzing what you're doing there and how you could improve retention is important. And then additionally, not just compensation, but do your benefits meet industry and local standards? Again, going back to, are you offering your current employees as well as candidates for open positions? Are you offering something that is competitive in your area and for that specific role? If you are not, you will be much less successful and have a higher turnover rate and spend a lot more time, effort, and money recruiting individuals for your open positions. And some additional things to think about is what is your training pipeline? Labs, hospitals, pathology groups need to be engaging their local colleges and universities so that students are learning about opportunities at their facilities, whether that's an internship program for future techs, technicians, technologists, for example, things like that. They need to know that this is a great career path. Like I said, we're not graduating enough pathologists, for example, to fill the positions that will be open when some of our older pathologists start or continue to retire. And so making sure that students are aware of these opportunities is important, and then also creating a pipeline for them to get some experience. It is a great way to get some new folks in your lab. And if they have a good experience, then a lot of times you can offer them a full-time position when they're done with their program, and your recruitment has kind of been solved for you there. So that's why it's important to keep that in mind. Consider starting a rotational program. Another example or another way that you could improve your training pipeline. And then, are there opportunities to cross-train or upskill existing employees who may be ready for bigger responsibility? This goes back to retaining people as well, creating a career path, a career ladder for them, recognizing when they could grow, and then offering them the investment of training them or mentoring them so that they can achieve that growth and then become your next great manager is just going to keep the cycle of success continuing. So just training your management team in general to understand the importance of consistent employee engagement, reviewing, analyzing your retention and hiring approach, that can really improve a lot for labs and pathology groups, hospitals, as they are trying to retain and recruit top talent. So just to wrap things up, and I see we have several questions, we'll get to those that haven't already been addressed from our team. But just in conclusion, annual compensation increases have a direct positive impact on morale of laboratory professionals. Unfortunately, the increase in compensation is modest. And because it's modest, it's not having a great impact on retention necessarily. So reviewing those practices, reviewing your hiring policies and things like that are very important. But besides just compensation, you can improve your retention practices by creating passive growth, career trajectories, investing in your employees for training, professional development, mentorship, and then regularly engaging them, making sure that they are feeling heard is so important for engagement and retention. And as an industry, we just need to do more to not only increase the recruitment of new individuals that will help alleviate the staffing concerns. That's also going to help with engagement, morale, and then ultimately retention, of course. And then in addition to that, we need to be advocating to increase the number of available lab degrees and training programs, as well as working with our local universities for those collaborative training programs, internship programs, and things like that, so that we are continuing to push this as a great industry to work in and a great opportunity to consider for folks who are entering the workforce after school. And I guess we'll get to our questions now.
Yeah. John, I didn't know if you I'm going to push one more offer here in case anybody wants to get in touch with us. But before we hit the questions, if you briefly wanted to touch on next month's webinar.
Yeah, absolutely. So, first of all, if we can help, we know staffing's an issue. When we poll labs, it's their number one issue. Laboratory managers, directors cite staffing concerns as the biggest, which is a little bit frustrating for us because we do have the solution for that, I feel like. And one of the things that we see and maybe need a little bit of advocacy from you guys on is we've made the decision to just specialize in recruiting medical laboratory scientists, right? We only work in the medical lab. We don't do staffing for nurses or pharmacists or x-ray techs and anything else, right? And so most hospital human resource departments will tell us, no, we're already working with a firm that does healthcare staffing across the board, which is great. But we do have the answer and go deep in lab. And I think that there's value there. We understand the difference between hematology and histology. We know what's needed. We're very in tune with the different complexity levels of testing. We build 60 plus CLIA laboratories a year. So we really, really know that well. And I feel like we're really well suited to get talent to laboratories that we're working with. But sometimes we have to push through the reason that they need to use a specialist versus a generalist. And so if your lab's using a recruiting or staffing firm, but maybe they're just a little bit more general and they're not getting the job done, we'd love to take a shot at that if you do a little internal advocacy for the importance of understanding the lab when you're doing staffing, because I think that is important. And we do have the largest database of medical lab scientists in the country. So enough sales pitch on that. We do have another webinar coming up next month. That webinar is going to be focusing on a pretty specific issue, but it's on a Medicare change to some billing. So if you happen to work in a toxicology lab in particular, this will really affect you. The change makes it so that you cannot bill for a urine drug screen as well as a confirmation. So the presumptive and definitive test, they've said you can get paid for one of those two things, which doesn't really make a whole lot of sense clinically out there, because there is a need for that quantitative analysis for a lot of therapeutic drug monitoring in particular. And you can't even bill that quantitative definitive confirmation test unless you run the screen according to the way that it's written. So it really takes an important tool for the opioid crisis in particular off the table. They've recognized that this is an issue. They've provided some solutions and paths to fix it, but they're complicated. So we're going to go over all that on the call. So if you're a laboratory doing that testing, we'd encourage you to attend so we can give you some guidance on what you need to do. Otherwise, you're going to really run into a pretty good cash flow pinch as you see a lot of denials of claims come through. So we'll be talking about that, but let's go ahead and we'll get into the questions. And
I've been monitoring those, John.
Yeah, Alex,
also a few for you guys.
Perfect.
Yep, just a handful here, but one of the first ones that came in pertaining to the younger employees who reported the lowest levels of morale. Of course, we've all heard a lot of breakdown about the youngest generation, Generation Z, job hopping a lot, changing careers frequently. One questioner asked, do you think the level of satisfaction for those with 5 or fewer years of experience tracks with the fact that this same population is more likely to leave their jobs after a short tenure?
Yeah, I think it's not an unfair conclusion. I don't know that we don't have the data to show that it was generational. I think it's probably correlated at a minimum that these are going to be younger techs. And then I think the questioner may be also indicating that you kind of do try on a career field, right? So those first early years in a new career field might be the time when you're determining whether this is a fit for you. And there might be a little bit more higher washout, but we thought it was worth reporting. We did, also conclude and hear that there was a lot of bullying, and that seems to at least be a partial factor. So it might not be completely that, hey, they're getting bullied, they're leaving. I think that's probably oversimplified. But I do think that it's a data point, and it's influenceable and changeable. It's a little bit harder to make somebody that maybe realizes that they don't like working in labs to change their mind about that. So they probably need to wash out and move on to something that's a better fit. But if you are losing techs because they feel unsafe, threatened, unwanted in your lab, that's something that we certainly can change, and I think is just not positive for our industry.
And that goes hand in hand with what I discussed about retention too. If you're seeing large turnover, especially for earlier techs or younger generation in your lab, diving into that, what does your retention policy look like? What are you doing to try to retain these people, not only just for your lab, but for the industry itself? It goes back to what John said about the bullying, and making sure that we're creating a welcoming environment for these folks, because they are the answer to our staffing issues and the fact that we're not graduating enough laboratory professionals to backfill the roles that are going to be open. So I think that is also, just going one step further, is something that we can look at together as an industry. How can we keep these people and keep them satisfied and train them up to be some of our top talent?
I think just to tack on to that, there's another thing happening right now where we saw a lot of new techs, I think greater than 10,000 new scientists enter the field during the pandemic that worked in COVID labs primarily. And this was a result of a lot of these newer independent labs opening and being a bit more flexible. A lot of times these were not techs that were certified by ASCP or came through a traditional CLS or medical lab science program with a 2 or 4 year degree. They may have had biology and chemistry degrees, received some on-the-job training, and were able to qualify as testing personnel through working in a CLIA lab environment for the number of months required. And then they got to a point where they meet requirements to work in the lab. I think there's an opportunity for us to keep those individuals, but it is going to require some flexibility and maybe changing of thinking, where if you're a hiring authority in a laboratory and your job description says you must have some national certification, that might be something that's more of a want than a need, they're going to meet the CMS requirements. Some states would have an additional state requirement, so those are less flexible. But if you're in a state that doesn't have a state requirement and you need to just meet the federal, we have Lighthouse Lab Services. We have every state's requirements for every complexity level detailed out. So I encourage you to check that out if you have questions about it. But oftentimes it's just 3 months of experience working in a CLIA lab, and these individuals have that. Now, their skill set is going to be specialized into one type of lab testing. So you may need to coach them up and upskill them to be able to be more of a generalist in other areas, but it is a possible solution, right? So it takes some flexible thinking there. And I would also say that there's probably some of that unwantedness or maybe feelings of bullying occurring from that, where if you have individuals that came through a non-traditional career path into your field and you sat through a 4-year degree program specific to this field and they did not, I could see how that would maybe give the feeling of, hey, you're not as qualified and maybe a little bit unwanted. And so I would encourage people to think more inclusively about that, realize that, hey, this is part of the solution. We need to be flexible. We need to be welcoming. We need to mentor and get these individuals into some of these key roles so that the scarcity and the shortage is a little bit less acute, which is going to benefit everyone.
Well, thanks, John and Tara. We have another question here, polling about standards for shift pay differentials. This may be something we have to lean a little bit more on what we know anecdotally, but this questioner asks that their organization only pays shift differential from 7 p.m. to 7 a.m. So evening shift only gets paid differential for 4 hours. They were told this was benchmarked and is now an industry standard, but do you find that practice to be widespread?
I don't know that we can comment on. We definitely didn't capture that in this survey. I think that evening shift typically runs from 3 to 11 in most facilities that I've seen. And so I think they're just saying that those first 4 hours, they're not getting a shift diff on that. I certainly have seen that not be eligible for shift diff until the evening hours, 7 p.m. sounds about right. But I've seen it both ways. And so I don't know what the majority stance is, though. Maybe people in the chat can help, or we could even throw a poll out there if someone wanted to quickly poll. I'm going to throw a bullying poll that we never fired out there for you guys too, to see if you're seeing that. But yeah, I think that the shift for evening shift certainly starts earlier than 7, but the differential might kick in at 7. It's not super surprising, but I can understand how it'd be frustrating.
Yeah, I think it's a great data point for us to think to include next year. So thank you for the questioner who asked about it. Just one final question here. It was asked a couple different times, but when we're talking about employee retention or attracting new employees, do we see ever that innovation in the lab is something that might appeal to a new employee? So things like learning new stuff, working on in laboratory developed tests, different innovative approaches. Do candidates usually respond positively to that?
I think innovation is always attractive to all candidates. In my experience recruiting, it's not a bad thing if you have an opportunity with a lab or a company that is innovating or doing something new. I think what we need to keep in mind in terms of recruiting and retention is that if you were doing something that is innovative, that's probably going to require more training, mentorship, investment in developing qualified or great people to work in our lab. And so we just maybe need to double down on those efforts. But I think innovation is absolutely very attractive to most candidates, particularly, new folks to the field. So these Gen Zers who have entered the workforce, I think most of them are excited about innovation and things like that. And so if we're looking to hire, recruit, retain those type of individuals and keep them in the industry, we need to continue to innovate, not only just for public health reasons, but also for the retention of these individuals, for sure.
Well, thank you, Tara.
Yeah, I would say most scientists I speak with would like to do engaging work, and the more that they're pushed into roles that are perceived as button pushing, and does not allow them to apply some of their training and discretion, that there's maybe a little bit less job satisfaction with that. There's a movement right now, I think Dark Daily just reported on it, and Clinical Lab News as well, as part of the solution to the staffing shortage being a stratification of skill set, so that some of the testing that is, I don't want to use the word complexity because it has a connotation in the lab. So it's more on the actual skills required to do the test. And it could be, sometimes a test that's easy to do can be categorized as high complexity. But the ability and discretion used to do a test, we should push that testing to the least trained, and then we should allow the testing that requires the most discretion experience being applied to be done by those techs that have that experience or been in the field a little bit longer potentially. That makes sense to me. That may require allowing individuals to come into the field through another career path, maybe a certificate program that's 1 year long. That's being talked about right now, where typically to be a medical lab technician, you get a 2-year degree at a minimum. Maybe there's a place for a bridge between the phlebotomist, lab accessioner workforce and the traditional scientists, techs, and technologists. There might be another step that's needed there. That's certainly being talked about. It could help with some diversity too, where we see a very diverse group inside the lab accessioner and phlebotomist group, but that they struggle to break through to the bench. And I think maybe a 1-year trade school or something that allows them to run low complexity testing would give a pathway for more scientists to enter the field and gradually grow in their careers as well.
Thank you both for that response. Just quickly here, we did put together a poll in case the questioner's interested on shift differential eligibility for the labs that we have on the call here today. Pretty even responses. 41 total responses. 44% say that the shift differential eligibility starts at 3 p.m. 24% say 7 p.m. and 32% say other. So it looks like it varies pretty widely across the board.
Yeah, I think you at least can walk away going back to your management team and say that the data is not supporting that 7 p.m. is the industry standard for it to start, because it looks like at least 75% of labs are starting at a different time than that. But it's a small sample size.
And perhaps that's one way that you can improve your retention, right? Is if you're able to just even start your shift differential, where you're paying I think we reported $3.65 an hour difference. If you have a few people on that 3 to 11 p.m. shift that John mentioned, if they're not getting that shift differential until 7 p.m., making those kind of positions more attractive by just bumping it up is really not going to cost the lab that much more money, but is really going to pay a lot of dividends in terms of engagement and employee retention and morale, I think. So maybe that's something you could take back to your hiring managers and decision makers too.
Yeah, it's a really good point. What I think that, if you are able to get your shift diffs, competitive or maybe better than market average, I think what you'll see is that your internal employees will respond to that. Oftentimes the seasoned techs are given first dibs on a day shift role. And so the openings typically show up when you have a job opening in your lab on an evening or a night shift, right? Hardest to recruit for. And so it makes it challenging to recruit. Say maybe is a senior tech that works at a competitor across the street, but they've worked their way onto day shift and they're not going to make a change to go start night shift again. If you're able to make your shift diffs competitive, I think you're able to fill some of those off shift roles internally and maybe have a few more day shift openings, which is going to allow you to recruit a more experienced tech. So yeah, I think that, that's a strategy for sure.
All right. Well, thank you again. Looks like we're bumping up just against an hour here, so we'll go ahead and log off. But thank you to both John and Tara for sharing their expertise. We We greatly appreciate it. And thank you to everyone who was able to join us here today.
Yeah, thank you guys for joining. Thanks, Tara. Thanks, Alex, for helping us moderate. Hopefully this was helpful information for you guys. And just a reminder that under the handouts, if you need to download this slide deck, you'll have it. And you are going to get a link to it as well. But we would encourage you to get out there and use this data to advocate for change, because it's important work that you guys are doing. Thanks.
Thanks, everybody.
Bye-bye.